What's going on YouTube? It's 3 weeks since my surgery, exactly today, and I just wanted to give you a quick update on how things have been going. They've been interesting to say the least. Last week, if any of you guys watched that video, I was wearing the Scarway silicone sheets, and I was wondering if, I wore it for one day, and the next day I took it off, and I had basically a red area in a rectangle in the shape of where it was. So I said, this is probably irritating my arm. Why don't I stop? Well, I did stop, but then I got a nasty allergic reaction. I mean, it bubbled up where the silicone sheet was. I mean, it basically like blistered. Have you ever seen like really bad diaper rash? Essentially, it's called contact dermatitis when you come in contact with something you're allergic to. But yeah, it blistered up and was super itchy and oozed stuff. It was just nasty. So I was icing it to kind of help with the itchiness. I was taking like Claritin, putting hydrocortisone cream on it. These are all the things that my surgeon was saying I could do, and sort of talk to my cousin who's a naturopathic doctor for any options on that as well. But so it started to get a little better, and the whole irony is I'm tempted to show you, but I don't think I will. If you guys want to see what it looks like, you can comment below, but I don't think you want to see. But my initial scar, it looked fine. And like the irony is that once I put that on, it just has looked horrible since then. And it's hard to really even tell how it's looking, but you'll see in a second. So anyway, it started to get better, and then yesterday I noticed that I was starting to have an allergic reaction a little bit down my arm, and I also was getting kind of itchy on my abdomen, and I noticed that it was kind of getting a little red there, so I was putting the hydrocortisone cream on there as well, did some looking online, and one site said that contact dermatitis, if that's what I had from the allergic reaction, can be spread to other parts of your body if that part of your body is touching the other. I don't know if it's as simple as that. I just got back from the dermatologist today because after yesterday I was like, okay, I need to go see somebody. This is not getting better. It's starting to spread. So lo and behold, today it's pretty gross. So here's my actual scar. Doesn't even look that bad. It's the surrounding rectangle there that has since kind of bubbled up and calmed down. But as you can see, I'm red all over. It's so freaking itchy. It's like on another level. And it's on my waist too. Oh, I mean, I could barely sleep last night. It was so uncomfortable, and then I was getting paranoid, like, oh man, I don't want to touch anything, and then I'm starting to think, oh man, like what if I'm allergic to like the sutures inside my arm and it's making me break out? Who the F knows? But they gave me a harder core steroid cream to put on it, and then I got an oral steroid that I take like 3 times for 4 days, 2 pills for another 4 days, and then 1 pill for another 4 days. They're nasty. I mean, they're the kind where like you put them in your mouth, and as soon as you swallow them, you can still taste it. And then the woman said to always take it with food because it upset your stomach. But as far as my arm goes, recovery, because I know that's what you guys are interested in, it's stiffer now. And it's got to do with this going on. I talked to the doctor about that today. I said, I felt better my first week. Like I could really have a range of motion, and now it's pretty stiff, and I'm pretty sore around here. I think a lot of it has to do with my skin going ape shit, my body trying to react and fix whatever. I mean, I'll tell you guys straight off the bat, if you're going to use those Scarway sheets after your surgery, just put it on your skin before you have your surgery to test if you're allergic to it. Just pick a spot on your skin, maybe leave it on for a couple hours, take it off, and if it looks a little red, because mind you, I only had it on for a day, like maybe 24 hours, maybe even less, and This is what I wound up with. You know? What the hell? Oh, man. It's like, so my surgery is so secondary now to the itchiness and uncomfortable feeling that, is with me 24/7 now. It's, oh man, today it's on another level of being itchy. And I just took all this crap and I'm waiting for any of it to work, at least dull the itchiness, but so I don't even know if I'm allowed to take the Claritin still with this. I don't even know if that was helping. But anyway, yeah, guys, it's real stiff, That's about as far as I can go without pain. I can get it further, but it's real stiff. Can't really straighten it out all the way too. So I've just been, I'm supposed to be doing these like, 4 or 5 times an hour, but now it's so freaking itchy there that I don't want to move my arm. I just want to sit here and, oh, it's so itchy right now. And I never touch it. It's like a test of will. But anyway, man, that's it. I don't really have anything else to that. If I had to say something positive, it's that the way I felt my first week, if I were to felt like that my second or third week, I probably would have overdone it really fast. In fact, I've probably done less in the past 2 weeks than I did in the first week because I've had this allergic reaction, and it's like, the doctor reminded me to take it easy, but having this on my arm and it being itchy and everything else, it's like a constant reminder that something's wrong in my arm. So I don't lift very much stuff or, do too much because I'm supposed to take a month to heal or whatever. But if I had to guess, it's probably going to be another month before I'm doing anything active again. Because I sure as hell don't want to do anything until this rash goes away. I'm not going to go into the gym or anything and gross everybody out or spread it to them. I asked the dermatologist if it was like contagious, like my wife could get it. She said no. And she was touching it with her bare hand or something, so I guess she should know what she's talking about. But, I wonder how I got it on my, waist. I guess maybe when it was oozing things, it was contagious then, and I was like, oh, should I use a different towel to dry off my arm than the rest of me? And she said I don't have to. So anyway, guys, ask away if you have any questions. Still seeing how my left feels. It sometimes it's hurting and sometimes feels okay. I won't really have an idea on whether or not I'm having to get surgery on that one until I can get back into some regular activities and be working out and typing and working on the computer regularly. So we'll see. But yeah, man, so boring, like doing this, just sitting around. I can't watch TV for very long. It just bores the crap out of me. I even signed up for a free trial of Netflix. The only thing I'm doing is my wife and I are watching Breaking Bad, which we never watch, which is a pretty kick-ass show, I have to admit. So anyway, that's my update. I'll give you guys another one at the 1 month mark, or 4 weeks, however you want to say it. And I hope this rash is gone, man, because if it doesn't, then life's going to be itchy. So anyway, man, hope everybody's doing well. Hope you guys find these helpful. And I'm just killing time right now, so I'm going to start going through all your questions that you sent in and replying. And if you have any others, just ask them below. All right? Later, everybody.